Hi, this is Dr. Lisa Solcenti's podcast, and I'm Dr. Lisa Solcenti. And today I want to talk about lab testing with your medical doctor. I get this question often, and although I have to be honest with you, it's best if I meet with you and I know your symptoms, I know your health history. Obviously, I could tell you what is more specific to the lab testing that you could add to the ones your doctor's going to do. And we don't know each other, so this is just a podcast. But in general, I can go over some markers that I think is really important to add to the testing. If they're not doing it, they might be doing this. But just to be able to really understand the first thing I want you to understand, and I did this wrong as well, is when your medical doctor is going to order lab testing, don't assume that they're ordering everything that you need. This was a big problem that I did with my thyroid. I did for years assume that my medical doctor was doing what's called a full thyroid panel. They don't do it that way, so we're going to start off with thyroid. If you are having symptoms of a thyroid problem, or if your doctor is going to check your thyroid, you don't want to do just TSH and T4. You want to do the entire panel. You want T3, T4, you want free T3 and free T4. You want that TSH, and then you want the two antibodies. There's a TPO antibody and a TG antibody. So that's one test, for example, that if you're getting that test done, just don't assume they're doing the entire panel. The TSH by itself is useless. The TSH just with the T4 is pretty useless. I know what they're looking for. I know why they're screening it, but I can't tell you how many people have thyroid problems that go undetected for years and years and years. And this is one of those scenarios I fell through the cracks. And also, it's one of those scenarios where you just know you don't feel good all the time. You keep telling them you don't feel well. They can't find anything. They're like, they're almost, making you feel like you're crazy, that it's all in your head. So the thyroid, for example, has to be the whole panel. And I do have a podcast on that. If you want to know more about thyroid, do that. The other area that you're probably going to get tested with your medical doctor is the cardiac panel. So typically they do the lipids, which really aren't lipids. So I don't even like that. I'm not even going to call it that. I'm just going to call it cardiac health. And typically that would be your total cholesterol, your HDL, your LDL, your triglyceride. And again, I just did a podcast on this. Under the cholesterol, the series, I did 2 podcasts on this right before this one. So cholesterol, HDL, LDL, triglycerides. That's usually what they do. And so, but again, don't assume that they're doing all 4 of those. Some doctors might go further and do like a VLDL or something like that. But what you can add to this panel to have more information is something called apolipoprotein A and B. They're telling us about inflammation. You also can do, which I think is super important, something called a C-reactive protein. That's really telling me about inflammation as well. So I really like the apolipoprotein A, the apolipoprotein B, and a C-reactive protein. And the last one that I personally would add to this one is something called homocysteine. Homocysteine is a marker too for more inflammation. So those are, for me, a great beginning screening panel for the cardiac. I want to see more than cholesterol, HDL, LDL, triglyceride. I love the apolipoprotein in there, A and B, the homocysteine, and the C-reactive protein. There's a lot more you can do, but that's a really great place to start, and it's not a big deal, to the insurance companies and stuff like that. If you go over to the diabetes panel, what I like to see with this one is typically they're going to do glucose. They might run that in, I guess it's the comprehensive metabolic panel, but you definitely want to test glucose. And you want to test A1C. Those 2 must be tested together. And most doctors do that. But again, don't assume it, because I've seen it like where they've done one. And I'm like, this is just weird. It's not standard. The other thing that I like to see with the diabetes panel is, so it's hemoglobin A1C and then it's glucose. And then I do like to look at insulin and what your insulin is doing. And sometimes they'll do the beta cell function, which is looking at the cell inside the pancreas, but you don't have to do that one. The one I like to add to the glucose and the hemoglobin A1C is insulin. And sometimes they'll run ferritin in this panel, but I love to put ferritin with iron, and that's more in the anemia world, but sometimes ferritin is in the diabetes panel. Ferritin and iron go together. You want those tested together. So let's go over to the CBC, which is your CBC with differential and platelets. You kind of want the red blood cells ran and the white blood cells ran. And this is really important. It's usually standard, and most doctors do this one. So if you click CBC with differential and the platelets, or just the CBC, you're going to get a standard lab testing. But again, don't assume that they're testing iron and ferritin in this. This is super important, because if we start seeing the hemoglobin not working right, if we start seeing anemia in the red blood cells, the next thing I'm looking for in the test is like, did they test iron, and did they test ferritin? Did they test the percent saturation? So you kind of want those things added as well. And then if we see anemia, you have to go over to the vitamins. And this is the part that's really lacking sometimes in the medical testing. I want to see iron, right? But you also want to see B12, B6, folate or folic acid. I don't see this a lot getting tested. I have to for anemia. And if I see folic acid, B12, and B6, that's where I definitely am going to be thinking, is there anemia going on? And I also want to see with this group, homocysteine. The reason for that is, and I just had this on a recent patient, it was actually an amazing lab, is that I drew it though. The doctors didn't draw it. I drew a regular blood plate panel, so white blood cells, red blood cells, yada yada. I did an anemia panel, but I picked what I wanted. I didn't do this general anemia panel. So I picked the typical, iron saturation. I did the B12, the B6. I did the folate, and then I added homocysteine to it because of MTHFR. If you listen to my MTHFR podcast, you can really start seeing MTHFR in the regular lab work. Now, this lab work that you get through your medical doctors, and I order these too myself, I feel like what these are like that iceberg that I talk about. When we are looking in the water and we see an iceberg, this is the tip of the iceberg. These are markers. These are buoys. These are things saying, hey, there's something going on here. Can you please come over here, dive deeper, and see what's causing these markers to go crazy? So they're not really like, truly diagnostic, where if something comes up, I can say, oh yeah, you definitely have this problem. You have to test sometimes further and go a little deeper. These are markers. So a really good marker that I found with a few patients lately, and I just get super nerdy about this, if I'm looking for, let's say, anemia, I am suddenly finding in my own thoughts MTHFR. Because if I see homocysteine high, and I see folate low, and I see B6 low or B12 low, okay, I'm thinking anemia for sure, but then I'm also thinking, hey, if your MTHFR, folate's low, homocysteine's high, B6 would be low, B12 could be low, and you start thinking, this could be an MTHFR issue. And you got to think that way, because you might still treat the folate deficiency. I might say, okay, this is where I would go with this, by the way. I would definitely give some B vitamins, B complex. I also would support the MTHFR, and I would probably test for it, but it's very hard to get tested through insurance companies. They just don't want to pay for this. So, we have a cheaper fee. The way we go outside the insurance company, we pay cash, but it's cheaper through my company. But that's not even to be thought about. But you want to test, you want to start doing the MTHFR protocol that I have. And the other thing that I would think of as I'm treating this is to think about, all right, I'm going to look at the MTHFR, I'm going to look at the B vitamins. But you're also going to want to look at the panel. It's very curious, is for glutathione. And unfortunately, I don't see the glutathione testing in the regular, lab testing that we're talking about on this podcast. So glutathione is in my micronutrient testing. This is separate from what we're talking about. And I'm going to, at the end of this, talk about the micronutrient testing and what glutathione is. And you're going to be like, what is she talking about? Folate, B12, B6, homocysteine. What is she talking about? I'm going to come back to that, because what this podcast is about is when you go to your medical doctor, you're getting your routine blood work. My patients ask me, my chiropractic patients, my anti-aging patients, my functional medicine patients, they'll be like, hey doc, I'm going to my medical doctor. I'm going to get some blood work done. What else can I add to the testing? And so those are the things we're talking about. So they don't tend to do that full anemia panel. And I love that one, because sometimes it's not anemia, and sometimes I start seeing like MTHFR, or if they don't tend to test B2, B3, if you could get them to test B2, B3, you might see a thyroid problem. Iodine is another one that sometimes they test, sometimes they don't test. I love the urine iodine test the best, but you could run the blood. And again, if I saw that low, I would definitely be thinking breasts, I would be thinking, thyroid, you're going to think testicles, you're going to think glands. So that's another one that you could add to this testing. So it's kind of fascinating. You definitely want to do the comprehensive metabolic panel, the CBC, the cardiac panel you'd be adding, I'm going to review it, cholesterol, HDL, LDL, triglyceride, add those apolipoprotein A and B, C-reactive protein I would add, the diabetes panel, definitely glucose, hemoglobin, A1C, and I, of course, would be adding in here insulin. The iron, the ferritin, that could go with the blood, the hematology, or they could run that separate. And then if you're doing anemia, iron, ferritin, or transferritin, that's another one, you're going to want to do that B12, that B6, that folate, and then that homocysteine, which also the homocysteine can be in that cardiac panel. So they kind of sometimes crisscross these little sections. Again, it's not like cut and dry. These wheelhouses do overlap each other. But that was what I wanted to share today. And then if you were worried about joint pain or anything like that, you could just run a basic, again, C-reactive protein is going to show us inflammation. So we've already talked about that. But in the joint panel, there's some things you can do. You can just run a basic ANA and a basic RA, rheumatoid arthritis, and you can start there just to rule out some joint pain and joint problems. And you can go a little further with that, but typically they start off low with that one, because they also can include, like, if you're talking autoimmune and if you're talking like inflammation in the body, you want to think about rheumatoid arthritis. So there's that RA test. You want to look at ANA, which is like an autoimmune. It'll look at stuff. There's Sjogren's, which is an SSA and an SSB. There's Lyme's, that's another test. But a lot of times this area, they might not do that in a routine blood test, just so you know. So those are things sometimes, again, we might put our little, I always say this, we see the iceberg, we're just looking at the tip right now, and we might put on our scuba gear, hold hands, and dive deeper, and then go, okay, let's look deeper at some of these markers. So I hope that answers your question. I love that question. What else can I add? The only other thing I can add here is I'm thinking is, because the comprehensive metal panel will look at your organs just on a general screening. If you're a guy, you could do PSA, looking for prostate, and do testosterone and the hormones, but I really like the hormones in the saliva testing. But you could run a general blood if you want, just see what's going on. The blood isn't going to show the tissues, where the urine is really showing what's going on in the overall body and the tissues. The vitamins. So vitamin D is definitely one, and you want the vitamin D that's floating around in your blood that's available, not the one in the kidneys. Try to think what else at the top of my head. The vitamin D, the B12, the B6. They don't usually run B2, B3, but if you could, that would be amazing. But they don't typically do that. If you can do zinc and selenium, wonderful together. They do sodium and potassium, so that's great. Magnesium, if you can get that thrown in there, that's amazing to look at. So any of calcium, any of the minerals, you've got calcium, magnesium, zinc, phosphorus, copper, like any of the minerals you can get in there, and any of the vitamins that you can get in there. Vitamin E is another one, vitamin A. These blood works these MDs can order these things. Before I go, I just want to talk about this, what I mentioned before, this whole MTHFR thing. What does she mean? What is going on with that? I do have a podcast on MTHFR. It's a genetic mutation. And I saw this actually on my son's panel, and it was just fascinating. I got super geeky with him, and he was just like, okay, Mom. His folic acid was really low, and he was telling me he was tired and having problems sleeping. So we just ran a basic blood work, and we did everything. I did the diabetes panel, I did the heart panel, I did just everything I explained to you, comprehensive panel, thyroid panel, CBC. I did actually throw in a little bit of the connective tissue autoimmune, but I couldn't get all of it covered. I did as many minerals as I can and as many vitamins as I can. And I was just doing a general panel. I really wasn't approaching this as MTHFR. I was just running a general panel to see what I could find, what little buoys would pop up. His white blood cells came back odd, and his folic acid came back deficiency. His homocysteine was high, which is very rare for a 24-year-old. The B, I think 6 was low. And there was one other thing that was weird, and I can't pull it out of the top of my memory. B12 was okay. B6, homocysteine high, folate low. There was something else. Oh, his testosterone was high, because I ran a little bit of that to see what was going on. And there might have been a few other things. The iron percent saturation was off, but the iron was good. So that's kind of like the panel that I got. But what I was really curious to see was, the blood is showing me not what's happening in the cells. This blood test isn't showing me what's really kind of happening in the tissues, but it's showing me what's happening in the blood, right? His reserve, like of what he's got going on. And the fact that my son has Asperger's and he has struggled, I've written the book about him. I learned leaky gut with him. I've done everything I do today is I've learned from helping him. I'm seeing it. I'm looking at this going, oh my gosh, this is the MTHFR, totally in full blown, in regular medical, I was just so nerdy about this, and just regular blood work that the medical doctors were on that I ran. I'm like, oh my gosh, it's right here. It's right here. So me leaving this can cause a cascade of problems. So I sat him down and I educated him. I said, look, at homocysteine, when this is high, you're only 24. This is usually high in older people. This is where it leads to heart disease. This is where MTHFR, by the way, is connected to heart disease and strokes and stuff like that. So, I talked to him very general about this. I didn't want to get him scared, but I just said, we don't want this high. So, of course, his question was like, well, how do we bring it down? I said, we actually don't touch this. We actually go over here. And I showed him folic acid. I said, this is low. This is a B vitamin. And this other B vitamin here, B6, I go, this is low. So I said, what we're going to do is we're actually going to work with this. And this is where we're going to work. And then I showed him the blood cells, and I showed him a little bit of the hormones, and I showed him the other wonky things going on. And I said, this is actually related to like a folate anemia. You're tired because you're anemic, but it's really driven by folate. So we went over and we explained it. And then he goes, well, what else could be causing this? Which I was so glad he asked that question, because I was about to answer it. I was like, there's something called MTHFR. And he's 24. I've talked about it to my kids before, but when your kids are really young, you're not telling them about MTHFR. When they get to high school, they don't want to hear about it, especially college. They're like, Mom, I don't even know what you're talking about. But now he's older and he's really into his health and he wants to learn. So I sat down and I explained again what MTHFR is. And so he wanted to know, what could he do? So I sent him my book. You're going to laugh. I'm like, here you go. I wrote a book. Read this. But I also told him about natural folate and how you get it, and that you want to avoid the synthetic form of folic acid. And we went through the whole protocol and the whole thing. And lastly, I said, the first step to do after we do all of this is really, let's do some food sensitivity testing. Let's see where you're at today at 24 with food sensitivity. So I said, what I'd like to do after we touch the surface of this and we do the protocol for of folate anemia and an MTHFR, and we work on that, then I'd like to reevaluate and dig deeper, dive down with you. I said, we're going to put on our little scuba gear and we're going to dive down and we're going to work on your gut. And I want to fix your gut health, because if your gut wall isn't working, you're not going to be absorbing the folate that you eat. You can eat all the beans and green leafy vegetables that you want, and I can give you as many supplements as we want. You won't be absorbing it if your gut's not working. So we talked about microbiome, we talked about food sensitivities, and he was like, okay. So this is where functional medicine is beautiful, because I just ran a general skimming of the body, just the top of the line blood work that your medical doctor does, that I do, and we found something so fascinating that is going to allow me to write a simple protocol for my son that he's going to follow for the next 2 months. And then we're going to meet up again, and we're going to see where he's at, how he's feeling, his symptoms, and all the things that were going on that made me do the blood in the first place. And then I'm going to dive deeper and try to do food sensitivity with him. If he lets me go to food sensitivity and microbiome at the same time, then great, we'll order both and we'll get those done together. But some people need to go slower. So if it's just food sensitivities and then he works on taking those out, and then and then we move to gut microbiome, we do one step at a time. So this is what's beautiful. So if you're listening to this and you don't work with me, or you're welcome to work with me, of course, just go to my website, drlisasolsenti.com, click on consultation, book it. I see people across the country and the globe, and we could just really have these conversations for you and help you. But if you're just, gonna go to your medical doctor and get regular blood work, and you just want to know, like, what else could I add? What else would I add to this? Because I'm going in there, and I'm putting my arm out and I'm getting the needle in my arm. What else could I order? That's what this podcast was, educational for you. It's not replacing anything. It's not treating you. It's just to give you that wonderful knowledge that you could walk into your medical doctors with, and you guys could work together and maybe dive deep together too and check things out. So I hope you enjoyed this podcast and you found it fun and informative, and I'll see you soon. Thank you.